After learning what Aberdeen, Scotland had done to have one of the lowest infant mortality rates with some of the highest risk women in Great Britain, I decided I need to take a look at data. I heard that Dr. Alex Burgess of Brown University was doing a study on infant mortality in Rhode Island, reviewing hospital and physician records. I got my bachelor's degree from Brown University, and one of my faculty advisors, Parker Martin, got his PhD from Brown and knew Dr. Burgess. We asked if I could go to Brown for the summer and have access to the data they were gathering. Dr. Burgess welcomed me. I received a small grant from Cornell to pay for an obstetric nurse to code the data that would be later punched onto computer cards for analysis. I wanted data from hospital statistics on women who had a low birth weight infant, less than 2,500 grams, a fetal death or a neonatal death or live birth. I gathered data for every live birth, 1,142 births, neonatal deaths 524, in 65 and 66 in Rhode Island. I wanted data for the following variables: age, number of births, results of previous pregnancy, a live birth or infant death, previous low birth weight infants, less than 2,500 grams, serious medical complications of previous pregnancy, serious complications of previous pregnancies, hemoglobin, minor complications of a previous pregnancy, minor obstetric complications. I took the data back to Cornell, had the computer cards made, and met with Professor Thomas Warren, one of my faculty advisors. Dr. Warren was a biostatistician, and I explained how I wanted to study the risks of prematurity and infant death. He came up with a method of developing a numerical risk factor for each of the categories of the variables I had collected. We developed risk factors for as many as 6 categories for each of the above variables. The risk factor variables showed a range of 25 to 68 for the 6 categories. The risk score could be calculated for every woman. There was a direct relationship between the risk factor scores and infant mortality. The highest quartile of risk factors had a mortality ratio 3 times higher than the lower 3 quartiles. We thought we would get comments and feedback if we submitted it to the Journal of Obstetrics and Gynecology. We were pleasantly surprised when they said they wanted to publish it. On August 1st, 1973, volume 106, number 7, was my first published paper. 3 years later, when I was with the Massachusetts Maternity and Newborn Regionalization Project and got to know the chiefs of obstetrics at all the Boston teaching hospitals, I got a telephone call on a Saturday afternoon when I was mowing my lawn. My wife said it was Dr. George Ryan. Dr. Ryan was chief of obstetrics at what is now Brigham and Women's Hospital. Dr. Ryan said he was sorry to bother me on a Saturday afternoon, but he wanted to know if I was Charles Donahue of Cornell University. I said I went to graduate school at Cornell. He then asked, "Did you write the paper on measuring the obstetric risks of prematurity?" I said, "Yes." He thanked me. He said his staff brought him the paper, and they were using it to identify high-risk women in their hospitals and clinics to receive early, more focused prenatal care.